first issue that I would raise, and that I hope we will get some good discussion on today, is how it happens that the United States of America ends up spending almost twice as much per person on health care, and yet our end results, our health care outcomes, are not particularly good compared to many other countries around the world. And I think one of the reasons for that virtually every study that I have seen tells us, is that we are much, much weaker in terms of primary health care, and we put much less resources into primary health care, comparatively speaking, than do most other nations. Today, in fact, 60 million people in the United States, nearly 1 in 5, live in areas where there is a shortage of primary care providers.
HRSA's analysis indicated that even with the increased use of nurse practitioners, of physician's assistants, the primary care provider workforce is not prepared to meet the coming needs. As of January 1 of this year, HRSA had 6,000 designated primary care health professional shortage areas. 6,000. In other words, we aren't meeting current demand, much less are we preparing for what's coming at us.
To those of us who serve on the front lines of healthcare delivery, access is more than just having an insurance card. It is more than getting care in an emergency room. Access is having a place to go for regular, reliable, high-quality preventive and primary care. By its very design, the locally controlled nonprofit health center model breaks down the barriers for healthcare to access, including those created by geography and income.
Healthcare in America is a privilege of the well-to-do and the well-insured, but leaves about 50 million people flat out of luck. These families live in fear of injury and sickness with no insurance or not enough of it. At RAM clinics, dental care is the greatest demand, with vision services a close second.
Primary care is something everyone needs and deserves, and yet it has a constituency of no one. Nobody raises her hand and says, I have primary care disease.
So one of the great ironies of the moment is that while there are some people who think we save money by cutting back on public health programs, whether it's Medicare, Medicaid, whatever it may be, the truth of the matter is we end up spending more money by not providing access to health care and dental care when people actually need it. So it's a question of easing suffering, human suffering. It's a question of preventing death. It's a question of preventing serious illness. And it is a question of saving money.
The THC program represents a proven and powerful strategy to address some of the key challenges confronting our healthcare system. These include ensuring access to care amidst a growing shortage of primary care providers and reducing persistent health disparities that plague our nation's most vulnerable communities. First authorized in 2010, the Teaching Health Center program is a 5-year program that directly funds primary care residency positions in community-based and ambulatory care settings like Erie. It is the only primary care physician and dentist residency program managed and directed by community health centers themselves.
We have one of these community health center residency programs in Connecticut, run actually by a former congressman from Connecticut, Jim Maloney, in Danbury. It has worked enormously well, and he points out regularly to me and others that the data suggests that a physician trained in a community health center is 300% more likely to stay in an underserved area than someone that's trained in a traditional residency program.
Even at the least expensive private medical school in the country, many medical students abandon plans of becoming primary care doctors because of student loan debt.
Across this country, in every state, the District of Columbia, and Puerto Rico, there is a student or a clinician whose future in primary care is being made possible by HRSA's workforce programs.
How do we recruit providers to underserved areas, both rural and urban? And I will simply state what others have said: expand the National Health Service Corps. It worked for me in 1978. It worked for 40 of my 200 clinicians on my staff who at one time in their career were National Health Service Corps, and that cuts across all the discipline.
Now we have over 8,900 clinicians working in underserved and rural communities. We know from talking to our National Health Service Corps sites and our community health centers that it's a huge recruitment tool for them. They are really able to attract very talented providers to come and work in those centers by the use of the loan repayment and our scholarship and our scholars who, when they finish their training, are highly sought after. And everyone says, I just wish you had more. Bring me all the physicians you can, train all the physicians, and I know we can place them.
I can tell you in my 40 years' experience, there's never been a program that puts clinicians, primary care clinicians, underserved areas like the National Service Corps. It is the crown jewel.
You come to us and you remind us that we know what the problem is. We just all say the same things. We get what is wrong. We see innovative solutions. We see effective solutions. We can see what needs to be done. It is now up to Congress to put the resources into it so that these programs can be fully implemented, so they can be fully funded, so we can have the right regulations in place for you to do your jobs for the American people.
Let me conclude in a hopeful way. I think we know where we have got to go, and I think virtually all of you have raised those issues about where we need to go. So our job now is to pick up that ball and run with it, and let's see if we can transform our healthcare system and put a much greater focus on primary care.